Welcome to Season 9 of Purposeful Empathy, a show dedicated to amplifying the voices of people from across the globe who believe the world needs more empathy and are doing something about it. Today's episode is brought to you by Grand Huron International, an on-demand coaching provider for individuals and companies. Thanks for watching. Enjoy the show. Welcome to a new episode of Purposeful Empathy. Today, I'm joined by Dr. Christine Chambers, who is a clinical psychologist and Canada Research Chair in Children's Pain and Professor of Psychology and Neuroscience and Paediatrics at Dalhousie University. She's the Scientific Director of Solutions for Kids in Pain, a national knowledge mobilization network. She's published over 185 articles in peer-reviewed scientific journals and was identified as one of Canada's top 10 most productive women in clinical psychology. She is also the principal investigator of the It Doesn't Have to Hurt social media initiative, which we're going to talk about in partnership with Erica M's YummyMummyClub.ca. Welcome to the show, Christine.
Thanks for having me.
It's great to have you. I've been wanting to have this conversation with you for so long, and thank you for making the time. I know how busy you are. I recently rewatched your TEDx talk and was stunned, the first time I watched it, to learn that premature babies endured surgeries and other painful procedures without anesthesia or any form of pain management as recently as 30 years ago. So what happened to change that reality?
Yeah, it's crazy when we look back now, to think that as recent as the 1970s and 80s, children were undergoing surgeries, like major surgeries, like heart surgeries without proper anesthesia or analgesia. And yeah, it was widely believed that, kids didn't feel pain the same way adults did, that, premature babies were too, poor, they weren't as neurologically developed to feel pain, or that it was too risky to use anesthetics with them. So we've come a long way since then. And what changed was actually sort of the collision of two things. One was a scientist at the time, Sunny Anand, was actually studying what happened to babies who underwent surgeries without proper anesthesia and analgesia. And what he found was that babies who didn't receive proper anesthesia, proper pain management, they were more likely to have side effects, and they were actually more likely to die from surgery than the babies who receive proper pain management. So the science, evolved to a point, but also it actually took, one brave parent, a mother named Jill Lawson, who went public with her personal story of how she had asked for her premature baby, Jeff Lawson, to receive proper pain management during a surgery. He ended up dying, and afterwards she had his medical record reviewed and found that he had not received this. So this, really helped to catalyze the whole field of children's pain research and children's pain management. But it really took the combination of science and also the really powerful personal story of one brave mother.
Wow, I love that fascinating collision of science catching up to the reality and a mother's story and love for her son to kind of come together and really catapult pain management in children to a different place. And you have devoted more than 2 decades of your life to studying how to lessen pain in children. You're literally a poster girl for purposeful empathy in action. So thank you for, again, making time for this podcast. Now, you've developed a social media initiative called It Doesn't Have to Hurt, which includes a 2-minute video that we're going to insert right here into our conversation. It's been seen over 300,000 times. Tell us what the goal of this video is.
Yeah. So as you mentioned, I've been a scientist for many years. I started as an 18-year-old summer student here in Nova Scotia, and was, publishing all this great science in journals and traveling around the world, giving presentations to academic audiences. And I thought that all of this science was, going to make a difference, right? That's why I became a child psychologist, was because I deeply care for and love children and wanted to have a career where I was going to have impact. And it wasn't until I had had my own children, so I've got 4 kids now between the ages of 11 and 16, that when my children were born, I realized that all this great science that I had dedicated my career to wasn't getting used to the benefit of my own children. So like I would take my children to the hospital and, all this science around best practices in children's pain management wasn't even being used for my own kids. So that's really what led me to this whole area of, public engagement, knowledge mobilization, making sure that research doesn't just sit on a shelf, but actually gets mobilized. And so we started with a 2-minute YouTube video for parents, and that grew into a much larger social media campaign. And really the goal was just to reach parents with information about children's pain management.
Okay, so your campaign actually launched pre-COVID, and then there was a ton of need for, little arms to get poked with vaccines, right? But now they're even being offered to kids under 5, right? So whether it's the regular inoculations, whether it's the COVID vaccine, whether it's the flu season vaccine, you have scientific and lived experience as a mom of 4 children. You have advice to offer parents when they take their child for those little jabs. What's the advice that you'd like to share?
Yeah, so there's again tons of research that has shown what works and doesn't work to improve children's pain management during needles. So we often talk about sort of what you can do before, what you can do during, and what you can do after. And of course, it all depends on the age of your child. And some of the strategies, for example, are appropriate for infants. For example, breastfeeding actually significantly reduces pain during vaccinations and other needle procedures. So that's a good example of a very kind of age-specific strategy. But beforehand, we advise parents to make sure you tell your child, give them advance notice that they're going for a needle. You don't want to lie to them. Some parents get so nervous about taking their children that they actually lie and say, no, there's not going to be any needles. I mean, that just really undermines trust and makes it worse kind of in the long run. So using age appropriate language, talking to your child about how you're going to have a plan. I think a lot of parents show up for these appointments not really knowing what to do. And so we talk to parents about using pharmacological strategies, for example. So there are actually patches that you can buy at your local pharmacy. It's like a numbing cream that you can put on your child's arm about an hour beforehand, significantly reduces the pain. So I always offer this to my own kids. Some of them decide that they want it and some don't, and that's a choice. So that's the pharmacological strategy. There's also psychological strategies. So just having distraction aids. So I always make sure I have an iPad with me with a video or a game that my children can get into. Some of my kids like to listen to music to distract themselves. So having some good distraction aids. Also relaxation, just helping kids to relax their bodies, to take some deep breaths. And then there's the physical strategies, which just involve making sure your child is positioned properly. Lying down actually can make needles hurt more. So making sure that if your child is old enough that they're seated, that they're upright, all of these small things, research has shown actually makes a difference. And then afterwards, really celebrating your child's success, framing it as positively as you can. We know that what children remember about procedures impacts how they approach the next one. So those are all just some tips that we share with parents that are all backed by research.
So I follow up that I hadn't planned to ask, but it kind of comes up for me now while we're having this conversation. I imagine that some of these things could be useful for dentist visits, right? Whether or not you got your teeth clean or have to go in for a cavity. But also, I wonder if you could speak to when a child busts up their knee, for example. I don't mean like a proper accident that takes you to the hospital ER, but let's say like cuts and scrapes and bruises and falling and boinking. And, what would you say about handling a child in pain?
Yeah, I mean, it's really challenging for parents when their child's in pain because it evokes such a strong response from us, right? Like we immediately become distressed. And one of the things that my research and the research of others has shown is like what parents say and do when their child has pain has a huge impact. So we really advise parents to try to stay as calm as possible. And actually, there's a whole body of research that shows if parents provide too much reassurance, like it'll be okay, it'll be over soon, that actually makes children's pain worse. It somehow serves as a signal. We had one study in my lab looked at sort of what drove that. And it seems like when parents reassure, their children interpret that as their parent being nervous. And so if kids think their parents are nervous, then it increases their pain and distress. So having parents stay calm, be responsive, but be fairly neutral, giving a lot of attention to pain in the absence of specific strategies on how to cope, how to be distracted, can actually make pain worse. So it's really fascinating to think about how we respond as parents and how much of our response is driven by our own anxiety and stress in a moment versus what's best for our child.
Okay, and now that elicits another question that I didn't plan for. Okay, we've all lived through COVID and we've all had different reactions to the extent to which we're willing to expose ourselves to public spaces, when and if we're wearing our masks, all of that. And there's probably in rear view mirror, we're looking back at maybe sometimes where we over guarded ourselves against some risks. Maybe we kept our children home. And now we're facing the unintended consequences of all that screen time has had some outcomes, the mental health issues, and kids that are now a little bit more anxious. I just wonder whether or not you could speak to, like, how could we gradually shift back to a place where we are managing and tolerating risk, but not to the extent where we're actually inflicting even more kind of stuff on our children.
Yeah, I mean, it's such an interesting balance, and I have enormous respect for the public health officials who've helped to guide us through this pandemic. But I do think that a lot of what we saw, children had to make a lot of sacrifices, children and families, to protect the health of others. And I think we're just beginning to see the tip of the iceberg around some of those impacts. And so I've always been a fan of advocating for making sure that the voices of children and youth are at the center of policy development. And how can we make sure that we always are taking that perspective? And I think we're in a fascinating time right now where we're seeing a resurgence of viruses that are impacting children, shortage of pain medications, for example. People are struggling to be motivated to wear masks. And we think about all the things that our children did to keep older adults safe. And now our children need us. So I think we are at a fascinating moment in time. And I think that our children have endured a lot. Our families have endured a lot. And I think what I'm hoping is that we'll see a repositioning of like making sure that children's voices and the voices of youth and families are at the table when there's conversations. These have been hard choices for decision makers, and I certainly, don't envy some of them, but I do think it's time that we take more of a child-centered approach to decision making when we can.
Oh, what a good message. I'm so glad I asked that question. Today's episode was brought to you by Grand Huron International, an on-demand coaching provider for individuals and companies. All right. As a psychologist, what advice can you offer parents about mitigating the new kind of psychological pain that kids are experiencing thanks to social media, whether it's fear of missing out or self-esteem issues or body image? Because you're a psychologist and you're mitigating against pain, like real physical pain, but I also think the psychological pain of the culture that we live in is not to be ignored or underestimated.
Yeah, no, it's a great point. And I think, as a parent today, kind of navigating some of these issues with my teens and preteens, like, boy, it's so different from when I grew up. And, the biggest issue was like how much time you got on the telephone each day. And, it's really the amount of information that our children have access to, I mean, is both incredible, but also terrifying. And I think, there's no clear answer on how to navigate. What we can say is it's here to stay. It's hard to restrict or limit your child's exposure. I think having open conversations with your children about both the positive and benefits of of, connectivity in the way that we have it now. And I think your earlier point around the pandemic just accelerated this. Like, I mean, it created a whole new way that my, at the time, 9-year-olds played with their friends, right, on FaceTime and playing video games together. It became how they could stay connected to other children. So I think rather than fighting it, I think we have to really learn more and embrace it, and have really honest conversations with our kids about some of the challenges that are the result of these advances in technology that are really new to this generation.
Again, having empathy and placing the child at the center and trying to imagine like what they're experiencing. I think it kind of speaks to um, an important part of parenting, which is, engaging with your kids and not just like, did you get your homework done and like go do this or whatever, but to actually make sure those lines of communication are open. I remember a friend of mine saying to me, if you can be the parent that does the drop-offs and the pickups with other kids in the car, maybe it was you, I don't even remember, but there's a special kind of dynamic that plays out when you're the driver and you've got a bunch of kids in the back and how they are chit-chatting with each other, that you're exposed to what's going on in their lives and that it gives you kind of fruit for a conversation afterwards. Like, do you agree with that?
Totally. And I find, I mean, I spend a lot of my time in my car driving, so does my husband. And I think using that time, to have conversations with your kids, whether there are other kids in the car or not, like I think it's, yeah, of course, a great time to listen and try to learn, from the dynamic. And I'm always approaching this from a place of learning, right? Like I didn't grow up in today, so I don't know what the pressures or challenges are. So I'm definitely trying to listen and learn, but I do use that car time very strategically with my kids around, it doesn't feel like a forced conversation when we're in the car together. It's a natural place to have that kind of conversation and really trying to learn.
Beautiful. Okay, a penultimate question before I ask the final one. I know you're on a big journey for a couple of weeks of travel for your work, and I really appreciate the time. I think there's a lesson for us to take away. So I'm going to ask you the question about specifically managing children's pain and the role of empathy in managing children's pain, but I have a feeling we're going to be able to extrapolate that out. So what role does empathy play in managing children's pain?
I mean, it's huge. And I would say not just for children's pain, but for kind of anyone's pain. I mean, what's fascinating about pain is that it's purely a subjective experience, right? So it's something internal that you experience that you communicate to others. It's not something that other people can measure, like your temperature, if you have a fever. It's not necessarily something people can see, like a broken bone, And so, people in pain are entirely dependent on other people, and in the case of children, whether that's parents, but for adults, it could be their friends or partners or health professionals. Other people caring, and other people being able to have empathy, to perspective take, to put yourself in their shoes, to trust. I mean, that what the person is telling you is true. I mean, people in pain often experience a lot of disbelief. They're often accused of lying. They're often told it's all in their head. And so I think, empathy is really such a core part of how people approach pain management in children and adults. And I think, one of the challenges of effective pain management is I think sometimes people don't take it seriously. I mean, why was it that anyone ever believed that babies didn't feel pain, right? Like every parent knows that a baby feels pain. So I, often think of some of our failures in pain management as like a failure in empathy, so yeah, I see empathy as just such a critical component of assessing and managing pain, and having an appreciation for the importance of pain and its management.
Yeah, and just the statement of how could we have possibly believed that children, babies, infants didn't experience pain makes me think about how limited our understanding of other living sentient creatures are, like animals, or even I think there's some new science around trees and living ecosystems that can also feel in a way that we may not have the language for, the science for, but like, why wouldn't we believe that all living creatures on the planet can't experience some degree of like ouch factor? Think about the planet, right now in climate change. Like, I think the planet's saying ouch,
Totally.
right? Okay, last question, Christine. This is my question. It's a delicious question. I never know what to expect. It's on a personal level too. Can you think of a time in your life when you were on the receiving end of empathy, and what that meant for you?
Wow. I feel like I've surrounded myself my whole life by people who give empathy. So I'm trying to think of like one single moment. I mean, I think probably the sweetest moments of empathy that I experience are from my children, right? Like who just I'm always amazed at how children can pick up on moods and pick up on signals and context and just say like the sweetest, kindest things. I know I was away for work a couple weeks ago, and my 11-year-old texted me and he said, "Hey mom, just checking in on you." Like it was such a cute way of framing it. It wasn't, "Hi mom," or "How are you doing?" But like he was making a point of letting me know that he was thinking of me and kind of looking out for me. So yeah, I maybe this isn't as an exciting answer, but I think empathy is one of the traits that I just look for in the people in my life. So, in my personal life, my friends and family, but also the people that I'm privileged to work with on my different teams. And yeah, so I feel kind of grateful to be surrounded by empathy like daily.
And I think that's the takeaway of the story is if it's not a big grand gesture, it was something as small as a little text that, you could count the number of characters that were in that question, but that signaled to you that you matter and how you're going through life matters to your son. And don't we all need to have little daily reminders of how effortless that is, how accessible, how free that is, and
Yeah.
how it really could change people's mood and the day that they have. So yeah, thank you for that story. So I'm gonna text somebody as soon as we hang up, and I'll
Yeah.
invite all our listeners and readers, go text somebody and let them know, how's your day going. What was it that he said?
Yeah. Just checking in on you, mom. Yeah.
Just checking in on you. Love it, love it, love it. Christine, thank you for all the work that you do, in public health and children's psychology and managing pain. This has been, I'm sure, very, very helpful for parents who have been listening and watching. So I want to thank you. And I want to thank my listeners and viewers, and we'll see you next week at Purposeful Empathy. What if you had access to your own council of coaches to help you break free of your thinking clutter, make that important decision, and liberate you from whatever is holding you back? At Grand Huron International, you get to choose the coach of your choice anytime from anywhere. Visit grandhuroninternational.ca and harness the power of on-demand coaching today.